I think at some level, we're all creatures of habit. We get into a rut. We do the same thing over and over again. And I'll give you one little example. I've been going to the same pharmacy for like 6 years, 10 years. I'm not exactly sure how long even. I just kept going. And what the funny part is, it's not the closest. I didn't know if it's the cheapest. But I just went. It's the first one I went to. I just keep doing it. And that may not be a good decision. And in this episode of Healthcare Hacks, we're going to talk about why that decision and that habit of going to the same pharmacy might be expensive for you. Hi, my name is John. I'm your healthcare hacker and a breaker of habits. Before we get started to talk about pharmacy costs this week, please take a minute, like this video, follow us on social media, and visit our website, athoshealth.com, so you can keep up to date with the latest healthcare hacks and ways to navigate our complex U.S. healthcare system. Today I'm going to talk about 3 ways that you can save some money on your prescription drugs. Now in a future episode, I'm going to talk about using manufacturer coupons and copay cards, as well as using some discount cash programs. But today I want to just focus on, let's say you have prescription, you have insurance, you just want to save some money when you get it filled. Well, really there's 3 ways you can do that. The first way and simplest way, it's amazing that we don't think about it, is shop around. If you spend more than $20 on a prescription drug, you should shop around different pharmacies in your area to see if you can get it cheaper. You can do this by going onto your insurance company's website and kind of following some links. Every insurance company is a little bit different, but almost all of them will allow you to price shop across pharmacies. What you might find is that pharmacy you've been going to year over year over year, like I did, is costing you money. There's a cheaper way just around the corner where it could save you some money if you filled your prescription there. So take a minute, do some price shopping. It's really important. Some drugs are thousands of dollars, and there could be hundreds of dollars of difference in prices. The second way you can save money is by using a mail order pharmacy. Now, this was something that was relatively new to me in the last couple of years. I was hesitant to have prescriptions shipped to me. I was concerned if they'd get there on time and just kind of the reliability. Much rather go to my local pharmacy. But what I found when I looked into it was 2 things. One is very convenient. Basically, they get shipped right to my house. I don't have to do anything. I put my credit card on file and they show up after my doctor sends me the prescription. It's amazing. And also, the second thing is they're cheaper. Oftentimes, if you get your drugs filled through mail or pharmacy, you can save 5, 10, 15% off the cost. If you go to your insurance company's website, you should be able to see if there's a mail order pharmacy that's part of your prescription drug network, and if so, what the cost is. Absolutely look into using it. It's convenient and it's usually the cheapest. The third and final thing you can do with your prescription, again, same prescription, even if you go to the same pharmacy, get a 90-day supply. If you're on a drug that's relatively stable, you're not changing your dosage, you've been on for a while, oftentimes a 90-day prescription is a lot cheaper than filling it month by month, and it's also more convenient. You know, when you think about like gasoline, it's X dollars per gallon. Well, in the prescription drug business, it's not necessarily X dollars per pill. In fact, the more you buy, usually the cheaper it is per pill. So you can see a pretty significant discount if instead of you go from 30-day prescriptions to 90-day prescriptions. There's a big difference in cost that'll be passed on to you, especially as you get in those high deductible plans. If you have any questions or comments about this episode of Healthcare Hacks or any other topic around the financial side of healthcare, please leave them in the comments below, and we'll try to address them in the future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.